Good morning, everyone. I'm pleased to represent the Health Resources and Services Administration to this group and to communicate to everyone
Muted.
And to communicate to this group as well as our stakeholders throughout the nation our sustained and enduring commitment to this very important issue. The Health Resources and Services Administration is the key federal agency that's responsible for the health workforce. We are responsible for making sure that our nation has an adequate supply, a well-distributed, qualified health workforce to meet our nation's healthcare needs. So within that agency, we have our Bureau of Health Workforce, and our mission is to connect those well-qualified health professionals to all the communities that are in need, especially our most vulnerable populations that are specifically in rural and underserved areas. And so it's the link to the rural and underserved vulnerable communities that has always had us interested in this topic. It's not new for us either, Susan, but we have a language to articulate it now. So we're very enthusiastic about supporting the IOM. We're very enthusiastic about this topic and want to support it in every way. The vulnerable populations, the reason we care is because of the historical oppression, all of the enduring poverty issues that link social determinants with the need for our health professional students to be aware of this topic. So we are very interested in having a well-qualified health workforce that's able to address issues of historical oppressions, continued poverty and disadvantage, and also having to be able to articulate and to see the impact on patients and to use that information to expect and work towards better outcomes. So that's what we're very interested in. We have made significant investments and initiatives driven towards this issue. Just a few weeks ago, our Division of Medicine and Dentistry dedicated their National Advisory Council to look at this topic and come up with recommendations. In our Division of Nursing and Public Health, since 2013, we've made over 40 awards, which total approximately a $40 million investment in getting our schools to use the social determinants of health, use a framework to understand how students are disadvantaged in their classrooms, how the social determinants may impact their progression and graduation. And so looking critically not only at looking at a student in a class and saying you're a disadvantage, you have a problem, so we'll fix you, but looking at the structures within those institutions, that those historical those legacies that remain and are very active, and how to remove some of those barriers so that students can be successful. So we are very interested in continuing this investment. We're very interested in supporting our partners to look at not only training our students to be aware of social determinants, to recognize and address them, but also moving beyond the students, to have the faculty not see this as a course to develop and teach, but the faculty to look around the class and say, you know, the social determinants are here in the class with me. They're ever present, and what will I do to remove any structural barriers that may be intentionally or unintentionally in place? It's not about blaming, but being aware of the environment, that often the most invisible factors that are operating that impact what happens to students. We want that, so looking beyond the individual, looking at the structural and historical components that address this in a critical way is what we would love to see in a framework. So yes, we're very interested in population frameworks. We're also very interested in achieving health equity, to take that serious. Equity is getting out of the way so that people can be the best, to achieve their optimal potential. It's nothing more complicated than that. So if we can get out of people's way and let them be what they were meant to be, I think that's the ultimate goal. Thank you.